Hello everyone, how are you all doing? Um, I know it's been quite boring sitting at home. Maybe I don't know how it was for you all, but it's been quite boring for me, and it's really hot. So we'll discuss about inferential statistics. I've been told that the remaining portions, the descriptive portions, are completed. So we'll start with inferential statistics. So this is the portion of inferential statistics that we need to cover. So we need to cover on the hypothesis and parametric and non-parametric tests, linear regression, correlation, and introduction to statistical software. So there are two different types of statistics. You can classify them into descriptive statistics and inferential statistics. Descriptive statistics basically refers to describing data, like say for example presenting them as classifications, tables, or making diagrammatic representations like bar tables, histograms, pie charts, etc. And even stuff like your measures of central tendency and measures of dispersion, which I believe you know. So that refers to arithmetic mean, geometric mean, standard deviations, standard error of mean, etc. It also involves the organization and summarization of data. So this descriptive statistics part has been completed earlier by Dr. Gangapure, and we'll be sticking on to the inferential statistics part. So inferential statistics part, as the name suggests, it is used to draw conclusions or inferences based on an observation. Like say for example, you would like to find out the risk of a particular disease in an age group. Like say for example, the most commonly used example that we all take is the risk of say developing lung cancer in a set of population who are smokers. So if you have such a group, then you do a pilot study or you do a cross-sectional study. So you draw some population you draw some samples from the larger population, and you do a study, and you'll be able to tell what is the possible prevalence or how much percentage of smokers may go on to develop lung cancer. That can be done using an inferential statistics. So it allows you to compute probabilities of future events, or it allows you to compute the risk factor, risk ratio, or etc. Odds ratio, risk ratio, etc. So there are there are two types of inferential statistical methods. One is for estimation and the other one is for hypothesis testing. So basically estimation refers to estimating things like a point estimate or a confidence interval, etc. Whereas hypothesis means testing of a hypothesis to say whether the hypothesis is acceptable or not. Now, what's a hypothesis? Now, hypothesis is basically a statement that is being tested. Like say, for example, I say a statement: smoking does not cause cancer. So my statement is that smoking does not cause cancer. So I can test the statement, and I could say whether the statement is correct or wrong. Now, so the statement is called as a hypothesis. It may or may not be true. Now I'm saying smoking does not cause cancer. So that is obviously a false statement. So this is basically something that refers to a population parameter or about a probability of distribution of a parameter which we wish to validate based on sample information. And generally, whenever you do a hypothesis testing, you need to bear in mind that it is very much possible that our finding is a by chance finding. Like say for example, I said smoking does not cause cancer. I take a group of patients who have been smoking for a very short period of time. It is possible that those patients do not go on to develop cancer, and it could prove my statement that smoking does not cause cancer. But that's a chance factor. That is because I have modified the samples. I've taken the samples in such a way that they will give the result that I want. There are two types of hypothesis. One is called as a null hypothesis, and the other one is called as an alternative hypothesis. The null hypothesis is usually signified or denoted by the symbol H0, and null hypothesis is a statement of no differences. So it assumes that the data comes from the same population, hence have equal means and standard deviations. What this basically means is it just assumes that there is no effect of the parameter being studied. Okay, so we'll discuss null hypothesis with some examples later. So The alternative to a null hypothesis is called as an alternative hypothesis. An alternative hypothesis basically assumes that the data comes from different populations, and this is generally the opposite of a null hypothesis. A characteristic to be remembered here is the null hypothesis is tested, but the alternative hypothesis is not tested. So when you test a hypothesis, you always do testing of the null hypothesis, and based on the outcomes of the test, you either accept or reject a null hypothesis. If a null hypothesis is rejected, it is assumed that the alternative hypothesis is accepted. So, like I said earlier, the null hypothesis could be something like smoking does not cause lung cancer. So I say that there is no effect of smoking on causing lung cancer. So it means that the possibility of a lung cancer is the same for a person who is smoking versus a person who is not smoking. So that is, it states that there is no difference, or that there is no effect. Now, when I do a testing of the hypothesis, say for example this hypothesis is rejected, then that means or one automatically assumes that smoking causes lung cancer, or that's the alternative. Or you may not say that smoking causes lung cancer, but you could in fact say that smoking has an effect on lung cancer. It could be either that it causes, or it could be that it is a protective effect. Either ways. For that you require further testing to find out which of those statements are true. Like I said earlier, the alternative hypothesis is not tested statistically, and its acceptance or rejection is determined by the acceptance or rejection of the null hypothesis. If the null hypothesis is accepted, the alternative hypothesis is discarded or is rejected. Whereas if the null hypothesis is rejected, the alternative hypothesis is accepted. And the probability of the null hypothesis being correct is assessed by a statistical test. This test is called as the level of significance, and the probability value, the p value, if the p value is too low, the H0 or the null hypothesis is rejected, and if the H1s or the alternative hypothesis is accepted. Now generally, depending on what level of significance you require, you set a particular p value. Now generally for all biomedical studies, we select a significance level of 5%, that is a p value of 0.05. Or in certain studies, you could even select a 99% significance, 99% confidence interval, that is a 1% significance. In that case, your p value would be 0.01. So if your test outcome, that is the outcome of the test that you do, it could be an ANOVA, it could be a Kruskal-Wallis test, or it could be a Wilcoxon-Sandine test, whatever test you do, if the p value of the test outcome is less than 0.05 or less than 0.01 or less than 0.001, depending on whatever p value you have selected, if it is less than that value, then the null hypothesis is rejected and you automatically accept the alternative hypothesis. So the level of significance, like I said in the previous slide, it is basically a probability of chance occurrence of observed results up to and below which the probability p of the null hypothesis being correct is considered too low, and the results of the experiment are considered significant. Now this is a confusing statement. This basically means that if you have a level of significance of probability value less than 0.05, then there is less than 5% chance of that occurrence or that finding which you have being happen because of a chance. So there is less than 5% possibility of your finding happening by chance. So that means that 95% of the probability is that your finding is a true effect or a true finding, or only 5% could be a by chance finding. Like say for example, in our example of hypothesis, if I make a hypothesis that smoking has no impact on lung cancer, or smoking does not cause lung cancer, I take a group of patients who have just started smoking or who have smoked only once or twice in their life. They can also be considered smokers. I take such patients, I follow up them using a cohort study, and I say that smoking does not cause cancer. That is a chance finding. But based on this population, even even with such a population, I can get a 95% confirmed possibility that smoking does not cause cancer. Now, in other words, if the p-value is less than 5%, now p is generally shown as a ratio, or p, like you have studied in mathematics, the probability is 0 or 1, and a 5% probability is generally expressed as 0.05. If um, if your p-value is less than 0.05, that is less than 5%, it means that the H0 is rejected when the sampling result, that is observed evidence, has a less than 0.05 probability of occurring if H0 is true. That is 5% level of significance means that the researcher is willing to take as much as 5% risk of rejecting the null hypothesis when it is actually true. We'll come to this a little later. So these are the different types of errors that can happening in hypothesis testing. Now look at this table. Now, like I said, the hypothesis testing always tests the alternative hypothesis, always tests the null hypothesis. So it is only H0 that you test, and you do not test H1. Now, there are two possible situations. You can have a situation where H0, or the null hypothesis, is true, or you can have a situation where the null hypothesis is false. Now, if the null hypothesis is true and you accept the null hypothesis, that's a correct decision. And if the null hypothesis is false and you reject the null hypothesis, that is also a correct situation. But there could be a situation where the null hypothesis is true, but you decide to reject the null hypothesis because your test values were less than p 0.05. Now that is an error. So the null hypothesis is actually true, and you decided to reject the null hypothesis because you got a p-value of less than 0.05. Now this error is called as a type 1 error, or it is called as an alpha error. And this is exactly what we discussed in the previous slide as level of significance. The next possible type of error is called as a type 2 error, where the null hypothesis is false, but you still decide to accept the null hypothesis. This kind of an error is called as a beta error. Now, between the two, that is, you have a situation where you decide to reject the null hypothesis when it is actually true, versus a situation where you decide to accept the null hypothesis where the null hypothesis is actually false. Which one would you think is a graver mistake? I would say the alpha error is a bigger error, because the null hypothesis says there is no effect on the outcome. Like, say for example, you are doing a testing of a drug. Say for example, you have a new drug. Let's take the example of diabetes. You have a new drug called, let's call it as diabetinil. You have a new drug called as diabetinil, which is being tested. You're benchmarking the outcomes of this drug using metformin, which is considered to be the most safest oral hypoglycemic agent. So your null hypothesis would say that diabetinil is not superior to metformin. That is your null hypothesis. When you do this testing, you find out that actually metformin is better than diabetinil, but you decided, or you did this study in such a way that you got a p-value less than 0.05, and you accept the alternative hypothesis saying that diabetinil is superior to metformin. Now, diabetinil is a new drug. It could have a lot of side effects. And when you accept the alternative hypothesis, you reject the fact that metformin is actually better than diabetinil, but you reject that hypothesis and you accept the hypothesis saying that this drug is better than metformin. You are actually doing a grave mistake. On the other hand, the beta error says that you accept the null hypothesis when the null hypothesis is actually false. The null hypothesis says that diabetinil is better than is not superior than metformin. The null hypothesis was that diabetinil is not superior to metformin. When you accept this, you actually end up rejecting the drug, the new drug, and you accept that your older drug is, or your older established drug is better. That is actually a decision that does not cause harm to others. So type 2 error or the beta error is generally considered to be a lesser error as compared to the alpha error. If you have any questions, if you're not understanding what has been discussed, please do not hesitate to put a comment. Now when you try to control these errors, now these two types of errors, that is type 1 error and type 2 error, are bound to happen in a research work. It is not possible that you minimize or you eliminate the errors completely. So when you try to reduce the type 1 error, the type 2 error would increase, because type 1 error, like I said, is a bigger error as compared to a type 2 error. So when you try to decrease type 1 error, the type 2 error would increase, and vice versa. So you need to reach a point where you are able to reach an acceptable level, where the errors are brought to an acceptable level, and that's where generally type 1 error, we keep a 5% ratio for type 1 error, and we allow up to 20% of type 2 error. These are usually numbers that are used commonly in studies. You could even come down to 1% error for type 1, and you could go down to 10% for type 2, so depending on the requirements of your study. Now, power of a test. You have seen power of a test in your syllabus. Power of a test is actually the probability of rejecting the null hypothesis when it is false. That is how powerful is your test that will reject the null hypothesis when the null hypothesis is actually false. Now this is denoted as 1 minus beta. Now if you remember, beta is type 2 error. And it basically measures, your power of a test basically measures how good is your test working. Confidence intervals. Now, confidence interval is defined as a range of values so constructed that there is a specified probability of including the true value of a parameter within it. That is, in simple terms, confidence values basically tells you how much is the confidence that you have that the actual value from the population would lie within the range that is found by you. We'll go to the next slide to understand this. So confidence interval is mathematically represented as 1 minus alpha. So you know what is alpha? Alpha is type 1 error. So confidence interval is 1 minus alpha. So if you have a type 1 error of 5%, the confidence interval would be 1 minus 0.05 or 95%, or 0.95 or 95%. So this means that 95% means that the observed value would be within 2 times the standard deviation of population mean. We will not break our head into all this. So basically, confidence interval is a range between what your actual values would value. Like say for example, you have an observation. This is your, say for example, this is your population mean. This is the confidence limits. So this is the lower end of it, and this is the upper end of it. So you mean to say that if this test is repeated, like say for example, your value is 9, your lower is 8.5, and your upper is 9.5. It means to say that if you repeat this test any number of times, you will get a result which lies between this 8.5 and 9.5. That is what is meant by the confidence intervals and the confidence limits. We'll be talking about parametric and non-parametric tests in the next video, but just before we go in, two basic types of tests. One is called as a parametric test and the other one is called as a non-parametric test. Now, parametric test is basically done on larger samples, and it has got higher statistical power, and generally all your clinical trials or all your major research works uses parametric tests. They don't use non-parametric tests, but there are certain problems with parametric tests, and one of the biggest problems with parametric tests is it works only on data with normal distribution. So you know what is a normal distribution? Normal distribution is a set of data which has got the same value. I mean, its mean and median would always be the same value. So it's a normal bell-shaped distribution curve. So parametric tests would work only with such data. It will not work with data that is skewed. You know what is a positive skewness and what is a negative skewness, and you also know what is a leptokurtic, bradykurtic, and mesokurtic. You know that. If you don't know, I would request you to kindly go back to the notes and check it, and if you need further assistance, please do mention it as a comment. The non-parametric test, on the other hand, can be used on any kind of data. You can use non-parametric test even if your data is not having normal distribution, even if it is a small sample size. Generally, small sample size is less than 20 samples, and it can also be used for data which is ordinal, ranked, or even for outliers. Now, if you do not know what is an ordinal data, ranked data, or outliers, please do leave it as a comment. We'll discuss about that in the next class. So with this, we come to the end of this class. If you have any questions, anything that you did not understand, please do leave it as a comment. I'll try to answer it in the next video. Thank you.